Hi, everybody. Good evening. Welcome to Evoke Therapy Programs broadcast. I'm Dr. Brad Reedy. Today is Wednesday, actually, April 24th, 2024. This was the broadcast I was supposed to do last evening, but I had something personal come up. So I'm going to be talking about part two of Evoke Therapy Intensives and what sets us apart. I prepared so much material last time when I was talking about our intensives. I only went through and talked about the Finding You, the kind of core and flagship program at Evoke. And while it's the flagship, it's the cornerstone for me, it's the foundation of everything else we do. There are some things that happen differently in our custom intensives for families and for couples. So I'm going to talk about that tonight. Before I get into it, to make an announcement again, if you're looking to get into your work, if you're looking to have months and months of therapy in just a short period of time over the course of 5 days, this is what the intensives is for you. It's a deep look into your history, into your family of origin, into the energies, the ideas, the feelings, the beliefs that shaped you, and then understanding how those energies are still affecting your life today in both positive and negative ways. So, if you want to do a deep dive, if you're already in therapy and you want to accelerate your therapy, if you're looking for the answer to the question of what is my work, Finding You is that option. We have one coming up real quick. We have a spot left at it. If you're interested, it's May 1st through 5th. The one after that is June 19th through 23rd. So if you're interested, contact our admissions department or look on our website for more information. Contact admissions@evoketherapy.com. All right. With that preamble, which is very appropriate for this evening, I'm going to go first start off with where I left off the other night. One important principle in all of this is this idea that the relationship that we have with ourselves is the fundamental issue in our lives, for better or for worse. That all the relationships that we have with other people in our lives will be in part largely dictated by the quality of the relationship we have with ourselves. James Hall has said the truth about intimate relationships is they can never be any better than our relationship with ourselves. So that's the starting point. That's why Finding You is often the starting point. But sometimes you want to work on couples issues. Sometimes you want to work on family issues or co-parenting. Sometimes you want to work in tandem and alongside the people in your life. And sometimes you want to find that bridge, that connection. And like we talked about with our Finding You, and like I always talk about with our parent coaching, with our virtual coaching, it's not that the technique becomes the thing for us. Yes, we use psychodrama, that's basically role playing. Yes, we have certain ideas and certain tools that we have in our back pocket. But what happens in psychotherapy is if the technique itself becomes the important thing, it ultimately eclipses the client. And the client has a sense of, I have to fit into this instead of them meeting me where I'm at. I love this quote by Stephen Mitchell in talking about analysis. He said, the emphasis is not on the behaviors, but on rigorous thinking, not on constraints, but on self reflective emotional involvement, not on the application of general truths, but on imaginative participation. This suggests a very different sort of technique. The discipline is not in the procedures, but in the sensibility through which the analyst participates. There is no generic solution or technique. There's a great deal of disciplined thought and the skilled practice of clinical psychoanalysis and continual complex choices. When we started our intensive program sometime about 8 years ago, we wrote a program for the individuals, we wrote a program for couples and co-parents, we wrote a program for families. And what we found was we came into the intensive with this idea about this curriculum that we were going to go through, these exercises that we were going to go through. And when it came to the couples and the families, it didn't quite always fit. It felt like they were waiting to get to what was important to them. I myself have participated in a family intensive, and I myself have had that experience. So after a while of trying to cram people into our model, we decided to open up. So it's really something that we do together. You bring your information, you bring your question, you bring your challenges. We definitely have tools in our back pocket, but fundamentally, this is your work. I'll say this before I launch in and start talking specifically about our couples work and our couples intensives. And this can be for co-parenting or for couples that are looking to have greater intimacy in their marriage, a happier, more meaningful marriage. The foundation is yourself. So if you're thinking about this and your spouse, your co-parent, your family members are at all reluctant to participate, I would strongly encourage you, for many reasons, to come and do your own work first. Because in couples or co-parenting, at best, half of the energy, half of the listening, half of the focus is going to be on somebody else. And in that way, therapy with a group of people is more difficult for the client. When you're in one-on-one therapy, you can really attune to the client. You can really spend all your energy trying to create safety for them and listening to them. And yet, when you bring in co-parents or couples or families, if I'm spending some time with person A in the group, B in the group might feel not heard, might feel like they're not being supported, might feel like that person A is misrepresenting them, and they're going to feel frustrated and upregulated by that. So it's more advanced, I would say, in a lot of ways. But like I said, if you're ready for it and both of you are willing, it can be an outstanding experience. I will tell you this, that at the end of couple sessions, and it usually, if it's a husband and wife, it usually lines up this way. It doesn't have to. In fact, there are exceptions, but it usually lines up that the wife is the one that wants to come and do the work. Women are more encouraged. There's less stigma around them doing therapy. For men, we're not supposed to need anything. We're not supposed to be vulnerable. We're not even supposed to really show a wide range of feelings and emotions, and definitely not have a lot of needs. So, men, probably about 80 or 90% of our audience tends to be women. At gatherings where we host co-parents and couples, it's probably about anywhere between 70 to 90% women. So if it lines up that way, what I will find is the reluctant partner, the reluctant participate. In the case that I've been describing, it is often the husband in a male female couple. But if it is that way, the reluctant person will often get to the end and say, "If I knew it was going to be like this, I would have come a long time ago." What they find is they're not the problem, or at least they're not the other person's problem. They're their own problem. And they're so used to being defined as the problem about why it's not working, why intimacy is so lacking. So that person, that individual that's in that position will often say, if I knew it was going to be like this, I would have come a long time ago. They feel very supported. The same thing happens in our family intensive with the identified patient, which is most oftentimes, the child. They feel really supported. They feel really heard. They feel really empowered. And what happens to the non-identified patient, or the spouse that is more willing and eager to come, is they realize, I came thinking that it was one problem, and I leave realizing that I know what my work is. I know how I have inadvertently been contributing to the very dynamic that I've been complaining about. And in that way, it's very empowering. Couples work can be difficult, though. I've said this for 20 years, that the implied energy often in a couple is that it's the other person that's the problem. No matter what people say, there's this idea that it's the other person that is the problem. And that if you could just fix that bozo over there, everything would be much better for the both of us. See, in the early stages of romantic relationships, there's this powerful delusional quality that comes with falling in love, that comes with the early stages of the romantic relationship, that blinds us to the differences, that blinds us to the challenges. It feels so compelling, that early romantic relationship, because it often reminds us of home, or at least the home that never was. We think we found that we don't see the limitations, we don't see the negative side. But of course, after a while and spending some time getting to know each other in marriage, those differences, those challenges become exposed over time. And also, what happens is the fundamental idea that we had when we entered into marriage had in it the fissures or the cracks that later become chasms. In other words, as I often say it, if I could have been around when I'm working with a couple who's really struggling, if I could have been around in those early days and heard your love story, your falling in love story, I in a lot of cases would have been accurate to guess this is where we would be. This is where we would arrive. Irving Yalom, who is a psychologist and a fantastic writer, wrote, "I do not like to work with patients who are in love. Perhaps it is because of envy. I too crave enchantment. Perhaps it is because love and psychotherapy are fundamentally incompatible. Love and psychotherapy are fundamentally incompatible. The good therapist fights darkness and seeks illumination, while romantic love, he says, is sustained by mystery and crumbles upon inspection. I hate to be love's executioner." Eventually, I wrote, when the stage of romantic love passes, the test begins. We have to take back the projections, the expectation that we have put on our partner. And then the question remains, can I assume responsibility for my own meaning and happiness? If both partners can answer that question, yes, then the marriage, the relationship begins again and makes way for enlargement. You know, there's this idea, I got asked this recently at one of our parenting workshops. Somebody said, can I ask a question slightly off topic of the topic focused today of parenting? And they said, tell us a little bit about that idea about marrying your parents. And of course, most of us have no conscious awareness that what we are being drawn to or attracted to has in it some element of home, some idea, some idealized version of home. And while our partner might look different, sound different, while they might have a different career, they might have different interests and styles, and seemingly might have a different personality, what we're really attracted to is this idea of what was our role with them? Were we there to make them happy? Were we supposed to be the good one? Were we supposed to be the one who comes on the white horse and rescues people? We were the one that held all of the sadness or all of the anger in the family. Were we the scapegoat? It's these fundamental roles that get replicated in marriage and in our courtship. And I wrote this. I said, you don't really marry your mother and father. That's not quite it. You marry into the dynamic you had with them. You find someone who will replicate the patterns from childhood, someone at the same level of consciousness and differentiation. If in a family, if we could measure differentiation on a scale, that is the idea of how connected and separate are we at the same time simultaneously. If we could measure that, it's maturity, it's awareness, right? It's nervous system regulation. If we could measure that quality, what we would come to understand is that when you grow up in a family that has on the scale of 1 to 100, let's say a 70, everybody in that family is somewhere around that 70 mark, somewhere between 65 to 75 in this theoretical grading system. If dad is sad, how responsible do I feel for that? If mother is disappointed and angry at me, how much of that is about me? That is the fundamental makeup of relationships. Contrast that with, if dad is sad, how can I be there for him or present with him or supportive of him and not take on the guilt, the blame, the responsibility for that? If mother is disappointed or angry, how clearly can I see that that is her issue and doesn't have anything to do with me? And then I'm not required, compelled to do anything about it. I wrote, we are shaped in a way that predisposes us to others. We find appealing what is familiar. In the early stages of romantic love, it's confusing because the old patterns seem so improved. We are finally able to soothe an anxious other. We are finally seen by the narcissistic partner. These temporary dynamics will eventually give way to the exhaustion of everyday life, and we settle into a kind of pain that is familiar. Then the work begins, and if you're lucky, you end up calling the other person your soulmate. So let's talk about the couples work and how we think about it. This is not a skill-based approach, although there will be skills and tools that will come up. That is not the fundamental issue that we address. We address the ideas that each of you have about marriage, the unhealed trauma that brought you together, the expectations, no matter how faulty or flawed they are. What are you expecting the other to provide for you? And in many cases, people buy into the delusional idea that is often taught or suggested by the dominant culture, that it's my job to make my partner happy and it's their job to make me happy. And we don't believe that is true. In fact, we believe that's impossible and the most likely kind of idea that will lead to divorce and to acrimony and to conflict and to a lack of intimacy. So we want to hear about you. We'll oftentimes go into your history, similar the way that we would with defining you, a little bit truncated. We'll go into your history. We'll understand the messages of your family, how you were talked to when you were in pain, how people received your anger, what kinds of things that they said back to you. And the great thing about the couples intensives is when you watch your partner, and in almost all cases, you have some experience and plenty of exposure to their family, so you have an idea. But to watch how it must have felt to them to be in that family growing up at the important developmental stages of their life, you start to fall in love with the little child inside of them, the inner child that has been hidden and protected by all the defenses. You see past their anger into their fear. You see past their resentment and rage and into their hurt and to their pain. And when that happens, you're less likely to be hurt by the things that they do. It's not that you deny it. It's not that you don't think I shouldn't be talked to this way or treated this way. Is that you realize it's not about you. This is what it means when I teach that for a marriage to be successful, we have to learn to fall in love with our partner's dilemma over and over again. That's what I think about in my marriage. What is my wife's dilemma? Where did she come from? How did she grow up? How did that shape her? How did the shape of her attract me to her? And then how does the shape of her interact with the shape of me in such a way that is either meaningful or difficult or painful or joyous? I love this quote about this idea of the projections of early marriage by James Hollis again. Of the many projections possible, he wrote, the most common are those onto the institutions of marriage, parenting, and career. Regarding marriage, perhaps no other social contract has so much unconscious baggage imposed upon it. Few at the altar are conscious of the enormity of their expectations. No one would speak aloud the immense hopes. I'm counting on you to make my life meaningful. I'm counting on you to always be there for me. I'm counting on you to read my mind and anticipate all my needs. I'm counting on you to bind my wounds and fulfill the deficits in my life. I'm counting on you to complete me, to make me a whole person, and to heal my stricken soul. See, we're looking for that perfect parent. And we often temporarily find that perfect parent, right? The person that will finally soothe us, the person that will finally listen to us, the person that's finally capable of really seeing us. Or conversely, when we see our partners clearly, when we listen to them and soothe them, we finally have that experience. It's like we're unlocked from the prison of our childhood. I can finally make my mother happy. I can finally make my father happy. I can finally get everybody around me to feel good about themselves. And that feels like healing. It really does. But what happens with the exhaustion of everyday life is you get tired of this rigid role. You get tired of feeling responsible for other people's depression or anxiety or substance use or whatever it is. You start to become resentful that your needs are often going unmet in the wake, in the shadow of these other energies. And you either get into conflict, you assert yourself clearly and work through it, or you act out in ways that are both unkind to both of you. Joseph Campbell said it this way. Joseph Campbell explained that in marriage, eventually facts will break through, destroying the projections of the early stages of romantic relationship. And what comes next, he said, is love. In marriage, he taught, we must transform our passion into compassion. There is a maturing of the relationship that happens. My wife called it the difference between marriage 1.0 and 2.0 in our marriage. The first 7 or 8 years of our marriage, it was the same circular arguments. No matter where the conflict started, it ended up at the same place. And after a very difficult period of time and work done by both of us individually, and then coming back together and doing some of that work together, we were able to see that the roles that we had accepted, the roles that we had projected onto each other, were flawed. They're in those roles were the beginning of the end of the marriage. So we had to transform, and I'm grateful every day. Every day I'm grateful for the fact that I married a partner who was willing to work on themselves. And I wrote this in response to this quote. You can also leave. You're allowed to leave. But your psychological work is still there to do. And if it's not done, you will recreate the same thing again because you are still unconscious of your projections. In my experience, soulmate is a term that is earned through the long, painful, and difficult work of taking back our projections and becoming who we are. If the marriage survives this process, it is magnificent. So in a lot of ways, it's helping you see your part, helping you see your projections, helping you take them back. And I really I talk about this idea all the time. It doesn't matter if you divorce or stay together. Not really. That's not the task. That comes out of the task. The task is, what are you okay with? And what's your part of this? I wrote this a long time ago. I said, when somebody tells me that their ex partner is a narcissist, I reply, that's interesting. But what's really compelling is discovering why you were attracted to someone like that in the first place. Why did you marry a narcissist? And usually the answer is, I didn't know. They've changed. And through gentle coaching and questioning, we all often, almost always discover they weren't different. Not really. You just couldn't see it because temporarily, your broken pieces fit together in something that felt absolutely intoxicating. The dance of filling each other's emptiness is exhilarating in its infancy and can be exhausting as it matures. Couples therapy helps partners to share in the journey and build a common understanding of the landscape of how their wounds fit together. So you come in mostly unconscious with the fact that the other one is the problem, and you come out realizing, what's my project? I talk about that all the time. What is my work? And can I stay focused on that? And out of that work, out of that healing, out of that enlargement, that awakening, that progress, comes the answer to the question about, will this marriage survive? Can it survive? Can it meet the needs of each partner adequately? You will learn that listening is often a giving energy. If I'm listening to you, listening compassionately, not just keeping my mouth closed and waiting to respond, if I'm deeply listening for the purpose of understanding and seeing you, I'm spending energy, the energy that I would call love. And that talking is often taking. So many people talk today about, there's so much press and ink around this idea that the key to intimacy is sharing your truth. And that is true. That is absolutely half of the equation. But the more nuanced, the more subtle process is listening to understand. And I would argue for a lot of people, the much more difficult part is listening. I think both can be challenging. And usually one person is better at sharing all of their feelings, and one person is better at listening, usually. And what we find is the listener has to do a better job of taking care of themselves, setting boundaries, speaking up, sharing their truth. And the talker often needs to work on listening better, managing their own nervous system activation, being responsible for their own anxiety, their own feelings, so that it's a safer place for the other person to share. When somebody says to me, I just want intimacy, I hear it, but there's always a bit of skepticism in the back. Like, intimacy can be terrifying. Intimacy means you're going to have to listen to absolutely the most difficult things. Really listen to them. Get outside of your own head temporarily and understand the world from your partner's perspective. So it's not that one is better or worse, or one is a higher ideal, or one is lower. It's that there are two things, there are two aspects. Usually the one that wants to come to therapy is the better talker. And usually the one that is reluctant to come to couples therapy is better at keeping their mouth closed. I wouldn't necessarily say listening, but at least keeping their mouth closed, containing. So each partner has to talk upon the compliment. And the talker has to understand how their lack of ability to listen and regulate their nervous system is contributing to their partner not talking. And the listener has to take responsibility. The one who's better at listening has to take responsibility and say, yes, my partner might be anxious when I tell them the truth. They might become reactive when I tell them what I'm feeling. But I have to learn to tell the truth no matter what. I have to take back that responsibility. James Hall says this: you can't live somebody else's life. You have to live your own. And so much of the time, we want to live somebody else's life. So much of the time, we volunteer unconsciously to try to live somebody else's life, to breathe somebody else's breath, as he says it. Breath, as he says it. Giving is important, but so is taking. And it's important to understand. Just recently, and this is after years of marriage, years of therapy, after some light conflict between my wife and I, there was a few minutes of quietness, and she said, "Do you want to talk?" Which I took as an invitation to talk. And I'm not the talker, by the way, I'm the listener. So I took this as an invitation to talk. So I said, sure. And then I started telling how I felt, which was calm and clear and assertive, and but had in it some difficult things to hear, some anger, some frustration. And she noticed right away that she became activated. And she said, wait, I thought you were going to listen. I thought I was going to talk. And I said, oh, you didn't say that. And she said, I see that now. See, sometimes in my anxiety, I want to talk, but I'm the one needing. Sometimes in her anxiety, she wants to talk, and so she'll invite me to talk, but she's the one needing comfort. And if you ask me to talk and I'm angry, and I tell you it assertively and clearly and truthfully, that's not going to soothe your anxiety. So you have to begin to understand the difference between needing and taking, giving and taking, excuse me. And one other point that I want to put here. Somebody asked me this a long time ago during one of our intensives, actually, our finding you. Somebody asked me when doing a role play with their partner who wasn't there, who was being played by somebody else. And the person stopped halfway through their interaction and said to me, is it okay to need my partner? To need my husband? She said. I said, of course, we all need people. But if he's your only source of support, that's going to be dangerous for both of you. You have to have multiple sources of support, because there's going to be times when he's unavailable. But furthermore, I explained, don't confuse needing with loving. And a lot of people do. A lot of people think to need somebody is to love them, and it's not. Again, neither one of them is better than the other. Not one is good, not the other is bad. They're different, and it's important to understand the difference. It's important to understand when you can give. It's important to understand when you want to take energy from the relationship, and it's important to distinguish between needing and loving. And this is important. This is really important. It's very critical that your partner not be your only one. It's very critical, like I mentioned earlier, that when they are unavailable for whatever reason, that you have other sources of support, which starts to, for a lot of people, make them feel very insecure about the relationship. Why am I married then? Well, the answer to that is because you've chosen to walk your separate paths together. Ideally, you've taken on the responsibility for your own serenity, your own meaning, your own happiness. Constantly learning to take care of yourself, and you come to the marriage happy, with the capacity to give the overflowing love that you have, that you've been gathering. Taking back projections, like I said, that, Hollis gets really clear about this when he talks about this dynamic in my favorite metal book called The Eden Project, The Search for the Magical Other. He says when he teaches this stuff about projections and the things I've been teaching tonight, that people get so frustrated and angry and disillusioned by what he's saying, or accuse him of being disillusioned, and say something like, you're taking all the magic, the wonder, and the joy out of romance, and it mustn't be nearly as bad as you're describing. He talks about that throughout the book. But what he explains is this is not bad news. This is the truth as we understand human behavior. And if you take on this responsibility for the things that I'm describing, he explains you can have a wonderful, joyous marriage that is expansive for both of you. But if you deny it, if you want to stay lost in the mystery of it all, like the quote I read earlier from Irving Yalom, if you shy away from the light of awareness that therapy provides for people, you'll keep experiencing these conflicts, these distresses that never quite make any sense to you. The question at the end becomes, what's your project? For me in my life, I'm just talking for me. For me, it is to tell the truth. I realize at this critical juncture in our relationship, I have been a lifelong liar. I've spent my whole life lying to people, telling them what they wanted to hear so that I would be loved. I'm not talking about business relationships or ethics. That I've always been had a very high standard, a very high commitment to. I'm talking about intimacy, friendships, marriage. Afraid to tell people the truth about myself for fear that they will abandon me. And while that doesn't frame me as a villain, it's impossible for both of us. So one of the things that we talk about in our marriage is I have to learn to tell the truth no matter how she reacts. And I'm not talking about being mean or unkind. I just have to learn to tell the truth about myself and how I feel. That's my project. And your project might be, if your complaint is that your spouse doesn't talk, your project probably is, or around the idea of you need to listen better. You need to take responsibility for your feelings so that the other person can be free to share how they're feeling. Because if they're made to feel responsible for your feelings, I promise you from experience as a therapist and as a husband, if they're made to feel, if they believe that they're responsible for your feelings, it's going to be very challenging for them to tell the truth. It's going to be very challenging, in other words, to have intimacy. Sometimes people will say, well, with my boundaries, with what I'm expecting, what I'm hoping for in a marriage, I'm worried that I'm either going to be a doormat, right? I'm going to light myself on fire to warm the other person up, sacrifice who I am so the other person can be happy. Or if I don't do that, I'm going to become so rigid, so selfish, so self-focused that there'll be no intimacy whatsoever. So oftentimes people will come with a topic. Let's say one of the partners wants to start a career or a new career. And that's the issue, the content over which they're arguing, over which their conflict arises. And so the partner that's experiencing this has this question. And the answer to that question is that is the right question. That's the answer to the question. You're asking the right question, but you're the only one that gets to answer it. I don't know. I don't know if this new thing that you want to do is so core to your needs, to yourself, that you have to do it no matter what, or I don't know if there's compromise. And you can still be who you are. You can still love and respect yourself. One important point that I want to speak to around this idea is my therapist told me a long time ago that the difference between a personality disorder, mental illness, and successful communication and asking for something from your partner is if it's a personality disorder, mental illness, it's a demand. You have to, you must. It's your job versus will you, can you? And again, if we grow up in a culture and in a thought process where our partner is supposed to make us happy, it's going to come off as a demand. And if the person doesn't meet the demand, they are a bad wife, a bad husband, a bad partner. And oftentimes one of the dynamics is the distance between you, the intimacy between you. is often illustrated by the idea of one person tends to be a distancer and one person tends to be a pursuer. So finding out where each person is, what each person's needs are, why one person is distancing, maybe why one person is starving to death and always pursuing. I wrote romantic love is the discovery of a home that never was. And when the projections fall away, as they must, the work for an enduring love begins. James Hollis, like a lot of analysts, does not prefer to talk or to treat couples because of some of the challenges and ideas coming into it. But he said, if he were to go back and do this, he would ask these series of questions, 7 questions for couples. The first question is ask each party in the relationship to pull back, reflect a while, and then convey their private and deepest fears. What makes them at night? What wakes them at night at the hour of the wolf? What has likely been a lifelong fear and shows up in many protein forms? This is not a question about the partner or even the relationship, but about their own voyage through this large, scary passage we call life. Question number 2. Ask each person what he or she brings to the table, which they know is annoying and painful to the other. That which has so often provoked discord, conflict, and hurt. Their interrogative shift of focus certainly upsets the therapist as referee paradigm. It usually puts folks back on their heels, and one may have to ask it again to make sure to them what we mean in it, and what they are to reflect upon for real. If they resist, he says, I would push them. Question number 3. Ask them to identify what they might do to lift some of the burden off their partner, especially in the light of the fact that they have just seen their partner hurting and vulnerable. This question obviously shifts the expected blaming back to each party to ask accountability for what they might concretely do to help the struggling person they see before them. Then ask each person what their own deepest needs are and how they are going to try to address them rather than their partner. Question 4. Ask each person what their own deepest needs are and how they're going to give it a try to address them. This goes back to the ending of the last one. How are you going to take care of yourself? Question number 5. Ask them how they might begin being more aware of the needs of their partner. And if not to wholly supply that need, at least be aware of its presence. Here, he explains, we approach the fact that in a healthy relationship with another for whom we care, we are both aware of their wounds, their history, and their needs. When possible, we can work with that and be part of the solution instead of part of the problem. Question 6. We then ask each partner what baggage they think they have brought into the relationship, both positive and negative, that now is present in the contemporary hour. And lastly, question number 7, we ask them separately and together what aspects of the implicit contract that brought them together have not actually served them. And then we ask their constructive ideas on what this kind of new contract might be written based on what they know of each other and themselves. This last question opens the real possibility of a new marriage. You'll notice that all of these questions place the responsibility on the individual partners. All of these questions tend to focus away from what can the other person do to make me happy. Years ago, my business partners and I went to a marriage therapist when we were having a lot of conflict. And we were all trained in marriage therapy. And the therapist said to us, he was also a business coach, he said, what do you think your job is in marriage? And we all thought about it and had thought about it for a while, gave our answers. And then he posited this question. He said, what if it was your job to be happy in the marriage? What if that were your job? How would you evaluate how you're doing at that? Do you see the difference? Instead of what can you do to make me happy? How capable and effective am I at being happy myself? So we start off with family of origin work. We start with the older members of the family, typically. We ask each person to show us their story, to show us what it felt like to be in their family of origin. And then we use that experience and we draw upon it for the rest of the experience to show people what they're up against in building a more intimate and fulfilling marriage. Where is the problem and what is your contribution to it? And again, the title of this broadcast is what's the Evoke difference? And the difference is that it's the continual complex choices. It's inviting a new kind of thinking, new ideas. Yes, there are communication skills. Yes, there are skills around boundaries. All of that is in play. But if you don't go to this deeper stuff, you really don't heal it. You don't understand where you are. If we're talking about family work, we always put the parents on the hot seat first. Even if the identified patient is the reason for the meeting, for the gathering, we want to start where it all started. And in most cases, it's pretty easy to see that the themes and the issues that the parents are having started long before the child came on the scene, and definitely long before the child started displaying the symptoms. And I say to the parents, we're going to put you on the hot seat, number one. Number two, show your child how to do it. It's so easy for us parents to look at our children, to get anxious and to think this is what they need to work on to be fixed. That's so easy to do. You all know that. It's so much easier to understand your spouse's work than it is your own. But one of the ways that we develop compassion is we show them how it's done. We look at our part. The heroic journey of the parent is the journey inward, the journey to look at yourself. Someone once said, all of the prophets have one simple message, and that message is go and find a mirror. Look at yourself. Like I said, everyone is on the hot seat at one point, but the identified patient is going to go last because they live on the hot seat. We start with the parents or the most resourceful members of the family, the most mature, the oldest. We kind of go down from there. And again, as the child watches, so many parents are afraid of getting into details. And you can talk to your therapist about this. So many parents are afraid of getting into the details of their own trauma and their own work. Is it appropriate to ask my child to hold this? And what I will say to them is, we will hold it. They're just watching it. We got you. They're off to the side. But man, how powerful and rewarding it is for a child to see, this is my parents' issue. This was created before I came here. This is what is causing me and us pain. And it's not all about me. What a gift that is for everybody in the family. I talked about partners before and the outcomes. The outcome with parents is that they realize what their work is. And it's not to fix the child. And it's not to gather tools to successfully manipulate or change the child. It's something about them taking back their responsibility for their own meaning, for their own happiness, for their own sleep, for their own peace of mind. And for the children, they come away feeling heard for the first time in many cases. Even children who have been to treatment, being able to do that work in front of each other, watching the parents have the responsibility for their own happiness placed squarely on their shoulders instead of the child's, is a remarkable healing process. And I think that even more than in couples where the unconscious message is just change this bozo and everything will be fine, even more than in that dynamic. With the identified patient child, there is this idea that clearly, because the child is doing a good job of wearing the costume, if you will, of playing the role. The idea is in the beginning, the child is clearly distressed, clearly struggling with mental health or addiction issues. So yes, we can talk about parents will think, we can talk about the nuances of our problems. But look at this. Clearly it is our child who is suffering. But it's all one organism. The child is just the one manifesting the symptoms. They're just the scapegoat, the one that carries the sins of the family. They're just the lightning rod. They're the place where the world comes into contact with the family's pathology. What's the Evoke difference? Smaller, more intimate groups. absolutely catered program, tailored just for you and your family, on the spot, together with your therapist. More clinical training. It's not just the really dynamic tool of psychodrama, which we love, this acting out, this role playing kind of work that we do. It's more than that. It's anchoring in what we know about child development. Doesn't matter if we're talking about marriage or families. Under anchoring in what we understand about child development, about how humans beings are built, how they're shaped. And I'm not just talking about child development for the child. You, mom and dad, are also a child. You're just an older one. But what lives inside of you are all the gifts, all the resources, and all the wounds and the trauma of your past. It lives in your body. And if it goes unexplored, it's running the show. And as it gets unexplored and unraveled and looked at, it takes a back seat. Doesn't disappear completely, but it's no longer in the driver's seat. It's the difference between your wound having you and you having your wound. Like I said, we don't impose a specific idea or curriculum on the client. This is all informed by trauma work, by attachment work, by child development. It's a deeper work. We don't give you the answers. We provide you with a process that helps you to find yours. See, that's the expertise of the therapists at Evoke. It's not that we're the experts on your life. We are experts, but not on your lives, not on your truth, not on your answers. We are the experts at creating a process where you can safely explore and discover your truth. That's our expertise. And that's a very different sensibility than I have the answers. Let me tell you how to live. Evoke intensives, custom intensives with families and couples is flexible. And we adhere to the idea that we meet you where you're at. You don't have to come trusting the process. You have good reasons to be skeptical of authority figures, of therapists. If you come skeptical and distrusting, we honor that and we meet you where you're at. That is the therapy. Tell us why it's hard for you to trust. Tell us your story. Because, like Carl Jung teaches, there's no illogical behavior. There's no behavior that's illogical. It's our job as therapists and in an Evoke program to find the context, the story, where that behavior makes absolute perfect sense. The clinical expertise leads the client to feeling safer, seen, and supported, accessing their creative, deeper self, and bringing it back into the picture. I think the most important thing about the work is the pace. We have time. I said to somebody I was supervising just today, I said, the greatest barrier for psychotherapy for clients is the pace. It takes so long to make deep, lasting transformation. It takes a long time. Conversely, the most difficult thing that comes into the therapist's mind is the eagerness to get to the end. You have to be patient. If you're too eager to fix, if you're too eager to help, you will inevitably end up acting like the parents they already had. Because that's what we have as parents, right? That eagerness to help. And the child just feels less than. All right, folks. That is part 2. If you want to understand the work, at a deeper level, my 2 books, The Journey of the Heroic Parent and The Audacity to Be You, are available on Amazon and Audible. You can use the QR code here or go to Amazon and search there. Excuse me. Like I mentioned earlier, our next Finding You is May 1st through 5th. It starts just in a week. We have a spot available, so contact intensives at evoketherapy.com or admissions at evoketherapy.com. Use the QR code on the screen or go to our website. June 19th through 23rd is the offering after that. We also have online offerings. They're about half the time and about a third of the cost. And a new announcement, and we have a new intensive coming up. We're going to be doing these on the road more often. We're doing our next one in New York City. I'll be running it July 31st through August 4th. So it's just outside of the city in New Jersey, about 20 minutes from the city. And we have a house that we've rented, and we're going to bring 7 individuals in. So if you want to sign up in advance. If you want to take a vacation to New York, if you live in the New York tri-state area, contact intensives at evoketherapy.com to sign up for the New York City Finding You. We have support groups for wilderness parents of our wilderness program. The next available offering is April 25th. That's tomorrow night at 7 p.m. Once a month, we have an alumni parent meeting only just for our alumni parents. May 20th is that offering at 6 p.m. Mountain Time. And then for our intensives and coaching clients and alumni, May 13th is your next support group. Contact support groups at evoketherapy.com or use the QR code or websites. If you would like to work with a coach who can work with you virtually anywhere in the world, contact coaching at evoketherapy.com. These are coaches that are trained in the model, in the ideas that I'm talking. So if you've been to an intensive, or if you plan to go to an intensive, they are a wonderful complement to that process. We ask all current parents to go to 6 of any of the following 12-step support groups: Al-Anon.org, CODA.org, FamiliesAnonymous.org, or AdultChildren.org. You can also go to RefugeRecovery.org or the National Alliance on Mental Illness, NAMI.org, have free classes and resources in your local community. All these broadcasts are available on Spotify or your favorite podcast app. Just go to wherever you consume your podcasts and search Finding You, an Evoke Therapy podcast. You can also go to soundcloud.com on your computer and find Finding You there. Or you can go to Evoke's YouTube channel and watch the video rebroadcast of these broadcasts and see the slides and my video face. You can find Evoke Therapy programs and me, Dr. Brad Reedy, on X, Threads, and Instagram using the handles at Evoke Therapy and at Dr. Brad Reedy, respectively. And of course, the Evoke Intensives program is on Instagram using the handle at Evoke Therapy Intensives. On Facebook, you can find us by searching Evoke Therapy Programs or Evoke Therapy Intensives. And our blog has wonderful content each week from our staff. These are not just education for you, but most often it's a staff talking about their own personal growth journey and relating to you. All right, I'm going to be back tomorrow night. This is a day late because last night something personal came up, so it had to be postponed till tonight. But if you have any questions, you can email us in advance to webinar@evoketherapy.com or just come on live and ask me then. You can always send in questions in advance in between broadcasts. You can send in requests for slides if you want any of these slides, so you can just have the quotes there. Or if you want to suggest a topic, webinar@evoketherapy.com is the email. Tomorrow night, April 25th, 6 p.m. Mountain Time will be my next broadcast. That'll be the live Q&A. I hope this is a helpful point of contact in explaining to you what makes us different. And while I often will tell people, go to anything that helps you connect your history and your past to what's going on today in any format, I really do believe that what we do at Evoke is different than most. Is a fundamentally trauma-informed, attachment-based, compassionate experience where the focus is on safety, not on advice and directives and giving you our answers. All right, folks, I hope this was a helpful point of contact, like I said. And for and on behalf of the people that you love and the people that love you, thank you for showing up and being willing to do your work. It makes all the difference in the world. Have a great evening, and I'll see you in about 24 hours. Bye-bye.